Welcome to all of our participants that are joining us now for the second panel. My name is Sabina Dewan. I'm the President and Executive Director of the Just Jobs Network and a Senior Advisor to the Global Deal Initiative. It is my pleasure to welcome all the participants again and all of our panelists to the second session on access to social protection. So during the first panel, we heard about the critical importance of social protection for ensuring that essential workers have the support that they need in times of growing precarity. By ensuring access to healthcare and by providing income replacement, social protection has shielded people from financial insecurity and in many countries from poverty during the pandemic. But there are still major gaps and important gaps in social protection, especially for informal workers and workers in non-standard forms of employment. It is my pleasure to welcome panelists that will discuss initiatives that have been taken by governments and social partners to address these gaps in the existing social protection architecture. So let me please introduce now Luz Vidal Oriquio, who is the Undersecretary of the Ministry for Women and Gender Equality, Chile. Rosa Pavanelli, who's the General Secretary for Public Services International. Juana Collado Zambra, who's the treasurer of FESINTRACAP, which is the International Domestic Workers Federation affiliate. And she's been working as a household worker since she was 17 years old. Welcome. And Laura Alfers, who's the director of the Social Protection Program at WeGo. So let's just jump right in. Time is short. Luz, if I could please start with you. And, you know, despite a 2014 legal reform regulating pay and encouraging the formalization of domestic workers, about half have remained informal and without access to social protection. So I wanted to start with you by asking you what measures are being taken by the government of Chile to address this? And did the government take specific measures after the onset of the pandemic to provide domestic workers with access to social protection? Over to you.
Sí, quiero primero partir agradeciendo la invitación.
I wanted to first thank the invitation.
Y acompañamos al presidente Gabriel Boric.
We are putting in place a number of reforms with the new government. I was a trade union leader for a number of years, during the pandemic in particular. I'd like to say that when we started under the pandemic, we were under a different government of President Piñera. And we had just undergone a process of social upheaval, which resulted in a complete renovation of our institutions, a new constitution, and economic and social reforms. A number of measures were taken, but not immediately. And the government was very late in responding to a very difficult situation, and it didn't respond enough. So ultimately, our slogan was, only the people can help the people. Women were particularly hurt by this pandemic, and particularly women who work at home and who are domestic workers, because domestic work is done essentially by women. The increase in informal work was quite strong, and the very first measures of the new government, rather the former government, concerned people who already had, for example, unemployment insurance, but that didn't cover informal domestic workers. 7% of the workforce. These people didn't have enough access, domestic workers didn't have sufficient access to formal institutions and formal social protection. So most of the support provided by the government should have been managed or had to be requested online. The fact is that domestic workers often are not familiar with computers, and so their situation only got worse. That had a real impact on the quality of health and particularly the mental health of these workers. The sector was particularly hurt by the crisis, not just in Chile, but throughout the Latin American continent. The consequences were particularly severe in our country. And I wanted to add that the law that you mentioned that was that targeted informal workers, particularly domestic workers, was negotiated with the trade unions, but the trade unions demanded protection for these workers in particular. The people who employ domestic workers are mostly middle class. And the tendency was to exploit domestic workers. And during the crisis, this became increasingly blatant. So a number of initiatives had to be taken to help these domestic workers organize. What we've shown is that the government can create links so that domestic workers who were excluded the previous measures could have access to them. So a number of measures were taken, and the provisions were revised at least 3 times. First in May 2020, with insufficient and differentiated support. So a vast swath of the population protested. So a second set of measures were taken at the end of July 2022, or 2021, right? About a year and a half after the pandemic had begun, which shows that the responses of the government were simply not enough and not relevant given the scale of the crisis, which is why in May, June, July 2021, a number of initiatives took place, spontaneous initiatives organized by the women themselves, who, for example, organized food banks, what we were able to show was that even the most vulnerable women were particularly vulnerable, in fact, because informal work and the lack of resources meant that these people received very little public support.
Yeah.
4 women out of 10 in these sectors pay into social protection systems. As a result, they didn't have access to that protection. The only thing they could do was draw on their savings to survive.
Yes. Luz, thank you. Thank you. And if I could just jump in here and just have you maybe offer one last quick word so that we can also have time to bring in other panelists. Thank you.
Bien. Solo plantear que
what I wanted just to say is that the measures taken were initially insufficient and that they didn't protect women in these very vulnerable positions. So the very last measures that have been taken are designed to provide support to the sectors that are the most vulnerable, and these measures have to target these people who are particularly vulnerable, this is what has been shown with the pandemic.
Thank you so much, Luz. And I think that the highlighting of the fact that domestic workers and informal workers were particularly hurt by the pandemic, and the importance of both policy-related measures, but also other kinds of instruments and empowerment of essential workers in order to address their circumstances, and the experiences that you shared with us, I think, shed light on some of those initiatives from Chile. So thank you so much. Now, if I could turn next to Juana and ask you, anecdotal evidence suggests that during the pandemic, domestic workers in Chile, often migrants without labor protections, were forced to have to choose to either remain in their employers' homes or even get fired. How did your organization of domestic workers address this challenge, building on some of the experiences that we just heard? So over to you.
Bueno, buenos días a todos, muchas gracias por la invitación. Bueno, la mayoría de nuestras compañeras.
Thank you for your invitation to contribute to this panel. A number of our members were victims of violence, physical violence, psychological violence. They couldn't see their family for months at a time. Had to leave their children with their own families so that they could focus only on the families of their employers, the employers' children. They actually had to, in some cases, replace the teachers who were no longer working. We had 4 points. Well, we had a limited amount of compensation that was offered at that point, but what we wanted was unemployment insurance. And the indemnity came eventually, but 4.11%, but it came too late because it only came very recently, and during the pandemic, no support was received. And we had to fight to receive unemployment insurance. I have a number of colleagues who were not even able to benefit from this additional unemployment benefit because it had already withdrawn from the fund. What we are demanding is an extra month's pay per year, and particularly for those who will not get unemployment insurance, who are not entitled to that, and to compensate for all those years of service during which their pay was so insufficient. So this is a demand we have now. It is one step forward to get to an equality with the situation of other employees in the country.
Sí. Entonces, por eso queremos ahora tener este petitorio que, lo que yo le estaba comentando, que podría ser muy
that's what I was saying. It would be very important to hold, to have say, an annual compensation. Unfortunately, with the new government we have, we are waiting to see what happens. We felt the support of the previous government. So we're going to hold a roundtable event with the government to try and find solutions to everything that is holding us back in progress. We have a law, but unfortunately, what's always lacking is actual progress. The individual domestic workers tend to be abandoned, but these workers really deserve respect and their work needs to be appreciated and recognized. We are people that hold up the economy of this country.
Thank you so much, Juana, for shedding light on the experiences and the important contributions. You know, I'd like to bring Rosa into this conversation now. Rosa, you know, sort of zooming out from domestic workers a little bit, COVID-19 really revealed that many healthcare workers, for example, and auxiliary staff who are critical to the COVID response, you know, are on short-term contracts or are working informally without adequate social protection coverage. So this clearly, you know, is a problem with several groups of workers. We just heard about domestic workers, and now we'd like to hear from you a little bit more about healthcare workers in particular. These workers themselves witness tremendous insecurity while trying to secure the lives of others. So can you tell us a little bit about the initiatives that Public Services International is undertaking to ensure that healthcare workers receive social protection and better working conditions for themselves, commensurate with the tremendous service that they provide to society as a whole? Over to you.
Thank you very much, Sabina, and thank you for inviting PSI to this interesting panel. Antes de todo, quería congratularme con...
First of all, before anything else, I would like to congratulate Undersecretary Luz Vidal and the government of Chile for advancing such an innovative political program with so much courage and so boldly, aiming to resolve the fundamental problems of inequality and injustice, which exist in Chile as in many other countries of the world. President Bajnić is going to go to a conference on quality public services for all in the next few weeks.
First of all, I would like to clear a situation that sometimes looks like a bias. Public service workers, health workers, yes, are among the most formalized workers in the labor market, but there are still millions of workers in the public system, in the public services that have no access to social protection, no access to the fundamental labor rights. Just to mention one, Liberia, workers are not allowed to form a union and to have the right to negotiate. And indeed, many of them were discriminated, including the leader of the health union that was threatened to be jailed and is living abroad since last year because they went on strike to protest against the lack of personal protection equipment. Same I can say for what happened at the beginning of the pandemic in Kenya, where 1,000 doctors were fired. And we fought with our unions there, mobilizing and advocating within the WHO and the global institutions to solve this situation. Many workers from Nigeria to Bangladesh continue to have no protections, continue to have no social protection. Many of them have not been paid overtime, and many of them have not been paid even salaries because of the need of the state to use the few resources in other areas. And of course, in this context, where I must say at the beginning of the pandemic, all health workers were in the same situation everywhere, totally unprepared to face the situation. The conditions of workers in the informal sector has been even worse. Just to give you an example, which is one of the areas where we are developing projects and working in many countries, in India, in Pakistan, in Bangladesh, in South Africa, in Zimbabwe, in Botswana, in Kenya, and many other countries. We are working to organize the so-called community health workers, normally considered as volunteer, but actually working under the direction of the health authority locally. And what we do and what we have been doing is, first of all, organizing these women in a union and forming their union. Second, negotiating with the local authority the formalization of their employment conditions. We have been successful in Pakistan with formalizing the work, the jobs of more than 80,000 women, 200,000 women in Mumbai, and many other reality. We are in the process to do that. And of course, we want to negotiate minimum wages, sick leave, social protection, the right to rest, to have a regular working time, because the response is formalization of the work. And there's the possibility to organize these women. And you know, I also think that the example is stimulating more and more women to come together and to challenge the situation in many areas. Once you see that if you dare to bring the right questions at the right table, you may have responses. So I think that organizing is the first response. Second, having the clear idea to involve the local authorities, because talking about social protection, which is crucial to protect workers along with decent wages. But if we do not raise the responsibility of governments, of local authorities when it's local, or national authority when it's national, we won't be able to ensure this is a right that all workers can enjoy. And it would be actually a de-responsabilization of a primary task, of a primary duty of government to protect their workers. So I think this is very, very much important. Finally, another thing that we did, we realized that the rate of informal work, precariousness, was higher in the privatized sector, and particularly in elder care sector. So with the Research Institute, we supported research to look why this was happening, higher rate of death in patients and in workers as well. And it turned out that in the two cases that we surveyed, there were fiscal illegality in the management of the organization, of the company, worse working conditions for workers, and very low quality of services. One was Revera in Australia, UK, and Canada, and the other Orpea in France, which has been a scandal on all the newspapers. So we think that investing in public social protection and in public services can be a response to better protect workers and better protect citizens as well.
Great. Thank you so much, Rosa. I think, you know, the emphasis that you placed on organizing and the involvement of different levels of government in the process of providing better social protection to build resilience, I think sets the stage very well for our next speaker. Laura, if I could bring you into the conversation. You know, there's been a lot of discussion, we just heard from, you know, from Rosa as well, about formalization. Now, informal workers represent 60% of all workers in the world and constitute a significant share of the workforce in the global South. You know, I'm in India right now, and here, if you include the agricultural workforce, 92% of total employment is informal employment. These workers have no or little access to social protection. And at the same time, there's also examples of countries like South Africa, Uruguay, Argentina, that have made some progress in extending social insurance to informal workers. Some of these efforts have also been stepped up, you know, during and in the aftermath of the pandemic. So can you talk a little bit about the model that some of these countries have adopted and what lessons might be useful for other emerging and developing economies, since we've been hearing so much about the importance of formalizing and the important role that social protection plays in the process of moving from informality to formality? Over to you.
Thanks very much, Sabina. Yeah, I mean, the thing about social protection is it isn't a one size fits all. So it certainly isn't about having one model that sort of countries can draw from. It's really about thinking what exists already in the country, what is the labor market context, and you know, what best suits that context for providing sort of fair and just and equitable social protection systems. You mentioned some of the really good examples in the world, of course, but I would say it's hard to find a single country that does everything 100% right, although these are really good examples. But I think there are at least four sort of learnings that we could pull out from some of the more successful countries. The first is around having supportive legal frameworks for social protection. So that's really important, and to cover all workers, because in many cases there might be a legal right to social security for formal workers, but informal workers are excluded from that. Also, there is often social assistance in particular is not codified in law. It tends to be codified in policy and programs. And that makes it much more vulnerable to political whim and to change. And it also means people have less sense of this is right. You know, South Africa is a really good example of where people understand, you know, social protection is codified in law very strongly, and people have a strong sense of it as a right. And I think that's one sort of really important lesson. I think the second is around getting the financing right. And obviously, if you ever have anything to do with social protection, this is always one of the key debates. And ensuring that there is public financing going towards the social protection schemes on offer. There's a range of incomes of workers in the informal economy, but many are not going to be able to significantly finance their own social protections. You know, recently there was a World Bank report on extending social protection to informal workers, drawing lessons from Africa. And one of the conclusions was that, a pragmatic first step is to create individual savings accounts for informal workers. But this is about relying on informal workers themselves, financing their own social protection. And I think that's just not going to be viable with the level of earnings we see amongst most workers in the informal economy. So public financing is key, and we can also think about other actors who could contribute. I sort of listened into the last session on home workers. Are there ways we can think about lead firms and supply chains, contributing to social protection systems? Domestic workers have employers. How do we ensure that those employers are contributing to the financing of social protection? The thing to emphasize, though, is that it cannot just be informal workers financing their own social protection. And that is the key to the financing discussion. I think there's some good examples, and perhaps we can leave that for later, about countries that have done that. Uruguay has a sort of implicit state subsidy in its social security system for informal workers. It lowers the contribution rate for informal workers, but sometimes you can have an explicit subsidy. So in Thailand, for example, the government actually co-contributes for every baht that is put in by informal workers. They will match the contributions. I think a third issue that is really important is getting the design of social protection systems right. Okay, and this is particularly true for contributory systems where we are expecting people to actually pay in some of their money. We need to simplify access. Having really, really complicated schemes that just, are going to take hours and days and weeks of people's valuable time, which is very often money for informal workers, is not a system that's really going to incentivize people to join up. Reducing administrative barriers, just making it easy as well when we're talking about employers and domestic workers, making it easy for employers to comply. We've been working on this issue on the Unemployment Insurance Fund in South Africa and domestic workers, and it's difficult for both domestic workers and employers to actually get onto the system. And that shouldn't be the case. It should be really easy to comply. And then I think a last point, and I'll stop here, is around trust, governance, and participation. Again, particularly where we're talking about, and this is true for the whole social protection system, whether we're talking about, generally financed social assistance like cash grants or food, or whether we're talking about, insurance schemes where people make contributions. It's really important that one, there are spaces for participation in these systems, and that must go through the whole system, not just let's have a consultation with informal workers right at the beginning and then forget about them. It means bringing them into the structures, the governance structures, and that can be quite hard because quite often tripartite structures do sort of not allow informal workers direct representation. But I think especially with contributory schemes as well, we need to make sure that people trust what is happening to their money, right? So that is about transparency, about information, and about keeping people sort of up to date about what is actually happening. So those are sort of four, I think, general lessons that we can pull out from some of the more general, sort of more successful extensions of social protection. Thanks, Sabina.
Great, thanks so much, Laura. And in some ways, I think you're the points that you laid out in terms of no one size fits all, simplifying access, the importance of trust, governance, and truly participatory systems, I think speaks to what all of the other panelists have been talking about in terms of their own experiences and what policy and other kinds of collectivization have been trying to move toward. So I think that your intervention brings that all together. We have a lot of questions from our participants, so I'm going to go straight to that. And Luz, if I could start with you, if you could maybe answer, we have a question from the audience that is, when it comes to extending social safety nets to vulnerable workers, and especially informal workers, what is the one key measure from the pandemic that you would like to see continued? So we have this window of opportunity, things are happening now. What is the one measure that has come about that you would like to see continue past the pandemic and have that be more entrenched? If you could please take maybe a couple of minutes, just 2 minutes or so, and give us your insights on this question, that would be wonderful. Thank you.
Bueno, sí, vamos a tratar de ser breve. Creo que una de las medidas que se...
En fait, one of the measures that we would like to maintain that were taken during the pandemic is to see how we can maintain support to small employers, those who employ essential workers, particularly domestic workers. One way is to incentivize them, to support them, so that they can make their employees formal. Because often we're dealing with people who are employers, to be sure, but they're themselves employees. And they may not actually earn enough to employ their own employees on a formal basis. So maybe a measure that would support small employers is a good thing, something that can help people be a little bit less vulnerable. This is something that was set up during the pandemic. Another aspect is inflation, which has appeared after the pandemic. So in this situation, some small employees just can't pay for formal workers. So what we would need is to support them, because otherwise they simply don't have the means to be in compliance otherwise. And that's one way we could increase the level of formal employment. In Chile, we had a rate of informality which was about 48%, and at about 48% of formal work as well, which isn't very high for Latin America. During the pandemic, we realized that a lot of employers were simply not in a position to continue keeping on formal workers, and informality increased. So they couldn't continue to maintain their employees in the formal sector. So we realize that because domestic work is fundamental, it's essential. So what we need to do is to make sure that we take the measures necessary so that this sector can go towards a greater level, a greater degree, a greater rate of formality. There are other sectors where we could increase the level of formality. I'm thinking about health workers who work but unofficially, people who provide support. And what we need to do is support the employers so that they, in turn, can support their employees.
Thank you so much for that, Liz. I think you raise a really important point about what kinds of measures are essential to supporting the small employers or different kinds of employers that might themselves be facing tremendous amounts of precarity during the pandemic, and what needs to happen, how they can be a conduit to creating better conditions and fair pay and provide social protection to workers. Juana, if I could turn to you and ask you, what is the one thing that you think would be fundamental to providing social protection and better working conditions for domestic workers?
Bueno, también estábamos viendo que el sector, la mayoría estaba en la informalidad. Primero hacer, por ejemplo, una medida que
the sector is very largely informal. So what you need is to make it mandatory. So that is, so that it has to, you need to set up controls and prosecute to a certain extent employers who don't who don't formalize their own employees. So there has to be a measure to make it, to prevent, to fight against informal work. For a number of employees, the problem was not to become a formal employee, but to just keep their job. So the urgency was to maintain the level of revenue for families, for vulnerable families. Because during the same process, there's been a 60% increase in the cost of basic goods. If you earn 150,000 pesos, you just can't continue to eat at the end of the month. So that's not enough to survive. So we got a number of colleagues who simply don't earn enough to live. Some employers, small employers, who are doing fine economically, and yet they're the first to let go their employees, and they're fired. They have no indemnities, nothing. And since they had no job contract, there's nothing they can do. So what do you do when you have to feed your own family? You have to buy food. Support measures were taken, but they were taken very, very late. And for a number of people, that meant that they had to suffer from violence, psychological, physical, because they were basically stranded in the homes of their employers. They were forced to live with their employers. They couldn't see their own families. They didn't know how their families were doing. So if there's one measure that should be developed, is support for mental health support for employees rather. Because conditions in which domestic workers are in some cases completely are simply not appropriate. They need, so the main thing is to make them, give them access to work.
A very important dimension, which is social protection is also an enabler to access other kinds of services such as mental health or other kinds of protections from exploitation of different kinds, and how social protection can actually be a conduit through which we can better protect workers and domestic workers whose contributions are innumerable, but whose contributions still are not visible. So what I wanted to kind of do now is to just zoom out a little bit, and again, you know, we've reiterated the importance of social protection. We've reiterated the importance of social protection in enabling other forms of well-being for workers that are invisible and visible. But we know that there's, you know, from both Rosa, your comments, and Laura, yours, that there's differences in sort of the financing and governance of social protection, you know, and that actually establishing these systems and having them function appropriately and extending social protection in, you know, emerging low-income countries in the global South is challenging. Could you talk a little bit about what are the key lessons that can be drawn from good models that can be sort of taken by some of these countries to move toward an iterative approach to building more comprehensive social protection systems for workers, and particularly informal workers? So maybe Rosa, we'll start with you, and then Laura. It's a big question. We only have a couple of minutes, unfortunately. So
yeah, okay.
A couple minutes each.
It's a big question, and we know that the resources are scarce. But we also know that there are trillions of hidden resources. And I honestly think that is simply hypocrisy if we discuss about extending social protection without fixing the root causes of injustice, that is the tax dodging that is at the basis of the global financial system. For me, the first response is addressing a deep reform of the corporate taxes, international tax system, making corporates pay their fair share where they produce and make profit, and not in the tax havens where they normally establish their legal headquarters. And fixing all the loopholes that are depriving, particularly in the developing world, countries of their resources. There are trillions and trillions every year going lost because of tax crimes, illicit flows of money. And we believe that this is the real root cause of injustice. This is the worst form of corruption that is affecting all the world. And probably this is the time to fix it, not only because we need to recover from the pandemic and ensure workers, all workers, are protected with social protection systems, but also because the situation risks to become even worse if we don't fix the climate crisis, if we don't fix the rush to strengthen armament instead of investing in social care and in social services. So that's for me, you know, in a nutshell. Of course, then there is the space, there is the possibility in a fair system that everyone can contribute, workers and employers contributing to the social protection, government contributing to the social protection. But if we continue to hide this reality, we won't be able to solve this problem. We won't be able. And the agreement that has been reached on the reform of the corporate tax is just benefiting the rich countries, is not benefiting the developing countries.
Yeah. Thank you, Rosa. You raise a very, very critical point. I do believe that taxation, all the research that my organization I have done really points to the need for a comprehensive tax system that holds those that need to be held accountable in providing social services, particularly as, as this sort of group of self-employed workers and growing labor market precarity, we need to have our tax systems work effectively so that governments can be the providers of universal coverage for all workers. Laura, I said I would ask you the same question, but I'm going to just refine that a little bit based on what Rosa just said. And she talked about taxing employers, which is a critical part of this. But informal workers are often self-employed workers. So how do you extend social protection to them? And again, this speaks to financing and governance of government provision of social protection systems. But I just wanted to throw that additional dimension in because WeGo is such an important organization in this space. Thanks.
It's a very good question, Sabina, for sure, and I'm glad you threw it out. Just to say, I do completely agree with Rosa's point about taxation, and I mean, it's not just clamping down on illegal taxation. In South Africa, in the last few years, the government has worked to rebuild our tax collection system after several years of it being eroded, and as a result, has had enough money to finance our social relief of distress grant, which is going to many informal workers for another whole year. So there's also a question about just like ensuring that the tax collection systems are working properly and are able to collect that general finance. I think on the self-employed, I mean, India is a great example of a country that's since the 1950s has experimented with ways to cover social self-employed informal workers with forms of social protection through what they call workers' welfare boards, right? So, for example, in the construction industry, and I mean, there are many issues around how these boards function, and I'm not saying that they're perfect, but they do provide us a model, right? In the construction industry, there's 1% tax or cess levied on the industry as a whole, which goes towards the financing of social protection benefits for workers in that sector, whether or not you have an employment contract, right? So it doesn't feature. And there are many different workers' welfare boards across India that have used similar different, drawn on different type, economic relationships outside the strict employer-employee relationship to finance benefits. So, beedi and cigar workers, there's the contractors are held responsible for some contributions. I think, headload porters, it's in the commercial relationship. When you hire a headload porter, there's an extra, cess added on to that relationship, which goes towards the financing of social security benefits. These examples never come up in the social protection financing discussions. And I think that it's really important that we start, I mean, in India, I know that they're under threat and changing and so on and so forth, but we've had answers to how to do this since the 1950s. And some of the answer, I mean, general taxation and public financing is going to be critical, but you're also going to need to think about how other powerful economic actors contribute. And in that case, taking sectoral kind of approaches. So for example, for waste pickers or for construction workers or for street traders, and thinking through where in that relationship can you find the leverage point for additional resources is really important. It's been done before. It can be done again. Thanks.
Wonderful. Thank you so much, Laura, for that intervention. And I'd love to continue this conversation about sectoral, universal, what is the appropriate mode for provision of social protection. Unfortunately, we've run out of time. So, it's been an incredibly fruitful session. And with this, we'll bring the first day of our A Better Future for Essential Workers to a close. And I think what the last session, as well as this session, have really highlighted is the important role that different workers play, whether they're healthcare and emergency workers, whether they're domestic workers, whether they are, critical workers in food supply chains or social care workers. the broader group of informal workers, you know, that these workers have been essential in keeping economies and societies functioning in the aftermath of the pandemic. And we live in a time of precarity, uncertainty, and transformation, where, as Rosa also mentioned, you know, there's other threats like climate change and so on that are really generating a greater need for the kinds of social protection systems that we have just been talking about in this panel today. You know, and these systems need to be built in collaboration with governments, with companies, empowerment of workers and workers groups, whether they be trade unions, civil society, through mechanisms like social dialogue to really come together and build resilient economies in a time of change and uncertainty. So with that, I want to thank all of our panelists for being here today, to all of our participants, and to, of course, to the Global Deal for, you know, hosting this excellent conversation with collaboration from the Open Society Foundation. So thank you all for being here as we bring a close to today. And we look forward to seeing you tomorrow, same place, same time, to continue this important conversation on a better future for essential workers. Thank you very much. Bye-bye.